It's been about a month since the rollout of the COVID vaccine. Here in Arizona, we're still in phase 1A, where healthcare workers are still getting the first doses of the vaccine. Phase 1B would include law enforcement, teachers, and other essential workers. Right now, there isn't a specific tier for pregnant women or women who are currently breastfeeding to get the vaccine. And there are a lot of questions, though, about whether or not pregnant women should be vaccinated. So Gina is taking those questions to Dr. Sharon Thompson this morning.
Yes, and so many questions in this particular subject. One of the main concerns here is that no pregnant or breastfeeding women with children under the age of 16, we should say, were included in any of the vaccine trials to date. So it's not really clear at this point how the vaccine might affect them. So we asked Dr. Sharon Thompson to join us here in Good Morning Arizona to talk about the recommendations. Dr. Thompson, good morning to you. Thanks for joining us. So much to talk about with this subject. You know, the health experts have told pregnant women and breastfeeding women they're free to make their own decisions, but with a lack of data, there must be quite a few women, you know, in this category, so to speak, in a bit of a panic. What are you telling them? And as the specialist in this particular field, what are you advising your patients to do?
Yeah, I think the key thing that you pointed out is the lack of data. So we're all operating in a data-free zone. Unfortunately, in the scientific community in America, we still have a system that for expediency's sake, will leave certain populations out. Pregnant women are one of those populations that were not included in any of the trials. And those of us who advocate for women and for pregnant women are disappointed by that. However, here we are today. I think that for all of us, we still have to rely on those measures that you covered so nicely in the previous segments. We still have to use our masks, stay 6 feet away, hand sanitize. So we still have to rely on those methods primarily for protection against this virus. For pregnant women, I think it comes down to what is the real risk for you of becoming infected with COVID versus the possibly theoretical risks of a vaccine. So if a pregnant woman works in an emergency room where she's coming into contact with folks who might be infected, or she works with people who are confirmed to have the virus, a vaccine might be the best possible outcome for her. But we really are operating in a data-free zone here.
Boy, it is. So it truly is a case-by-case basis. So, you know, Dr. Thompson, what we do know about this vaccine is there is no live virus. It actually helps our own cells create a protein. It really kind of spurs our immune system. So I would think that one of the big concerns is, would it cause mom's immune system to fight the fetal cells, to fight the baby?
That is an excellent question, in fact, and that's a question that some of us have because we don't know. We don't expect that because given the way the vaccine is formulated, there's a low risk of that happening. However, we know that biology can surprise us sometimes, and so that's one of the reasons we're so looking forward to actually having studies in pregnant women that establish that safety profile, that we actually have studies that show it's effective. One thing we know about pregnant women is their metabolism is a little bit revved up in some ways. And so is the vaccine as effective in pregnant women as it is in the rest of us? We don't know that until we have those trials. Now, we've heard from federal agencies that some of those trials are set to begin this month in January. So we're so looking forward to those to answer excellent questions like the one you posed. Other questions: does the vaccine cross the placenta? How long does this immunity last for pregnant women? How does it affect fetal growth and development? Does the mRNA that breaks down in our cells so quickly do the same across the placenta? We don't know. Those are some of the questions that we want answers to. And so we're so looking forward to these trials starting and the information that we'll get from pregnant women who have to be vaccinated because they're in those high-risk groups I mentioned.
Dr. Thompson, we could talk to you for hours on end about this subject. We're just about out of time, but I have to ask you about breastfeeding women as well. Could the vaccine, would it pass through their breast milk? Does it also send antibodies to baby as well? Or how could it affect a newborn? Do you have any ideas or data that you've seen from your expert perspective that could enlighten any of us?
Yeah.
Darn it. We've lost her signal. Dr. Thompson is, she's so full of good information and a wealth of information. I'm sure you can hit her up on social media and she'd be glad to answer your questions. But still, so many questions remain with regards to pregnant women, breastfeeding women, and the vaccine.